Welcome back to Living Local. Move better and feel better. That's the goal of chiropractic care and massage therapy. A local clinic combines both types of care and other natural health techniques to help patients feel better in their bodies. Joining me now is Dr. Sean Duncan and Kaylin Hilton with Functional Integrated Techniques, or Fit Chiropractic and Massage. Thank you guys so much for being here.
Thank you for having us.
Yes, so first of all, Dr. Duncan, why should someone visit a chiropractor?
Someone should visit a chiropractor if they are having any kind of pains, not moving correctly, any other ailments that, whether it's shoulders, back, hips, knees, ankles, any part of the body that's not functioning to what they want. Come visit a chiropractor so we can help them get the process of getting it back to where it should be.
And Kaylin, what about a massage therapist?
Anytime there's tension in an area, it's really good to come in and get it massaged. That way you get circulation back in that area, especially if you are coming to get an adjustment as well. The massage loosens everything up and lets the bones slide right back in.
Yeah, that leads me to my next question is, what are the benefits of combining chiropractic care with massage therapy?
Well, using both, usually we like to have the patient come in, do the massage therapy first, help loosen up the muscles, get blood flow rolling through the body. It makes my job a lot easier to move the bones where I don't have to necessarily do the hardcore rack 'em and crack 'em.
Right.
We use a lot of different techniques, which a lot of people appreciate that, so they're not leaving in pain. We want to let them leave the door, go outside, and feel better.
So it almost warms the body up to having that adjustment happen. So what does Fit Chiropractic do maybe differently than other chiropractic clinics?
Well, combining the massage therapy with the chiropractic care, we also go a step further. On my table, I do a lot of muscle testing because I look at it, if the muscles aren't firing correctly, working correctly, then it's just going to pull those bones back out. So I use, they're called Mia straps, and different muscle testing to check the muscles, refire them. Now granted, there's stressors, anything can happen in daily life. Some people need it more often than others. But I want to fix the muscles so the bones will stay where they're supposed to. You don't have to be in our office.
Right. And in addition to getting an adjustment, getting massage therapy, what other types of techniques do you guys offer?
We do muscle scraping. We do the Mia straps. We do cupping, stretching, and any other functional techniques that we could use to help move you better.
So I've heard the terms of muscle scraping and cupping before. Walk me through exactly what that is.
So the muscle scraping is you will scrape to get blood flow rolling through those muscles, and you always scrape away from the body. It depends how much pressure you do. There's a couple different techniques. You can use more pressure. Some body parts, your Achilles tendon, yes, it's going to hurt a little bit. But yeah, you're trying to get blood flow, oxygen to that muscle so it'll help repair. The cupping, same thing. It's kind of like a massage therapy, but it's a decompression. So it's pulling the blood through so new blood can rush in, get oxygen, help it release and relax.
Who would be a good candidate for those types of techniques?
Almost everybody we see.
Wow. And you mentioned the straps too. Kind of walk us through, demonstrate really how those are being utilized in your practice.
I will actually have Kaylin lay down here and we'll do a quick low back adjustment and use the straps here. Okay, go ahead and lay down there.
Right, so she just lays on the table there.
So with these guys, we already pre-checked her.
Okay.
And she's got a hip that's rolled back. So we use the drop table over some of that hardcore racking. And we put some pressure and push. And then now we got that hip adjusted, shifted back where it's belonged. Then we check the sacrum, and we use muscle checks to tell us what's going on. I've already checked her out, so we know that she was having, so these are the straps. We already have one set up here. So we would have her lock, lift this leg, and we're going to muscle test through here. So go ahead, lock and lift, up and down. You still feeling that pain, tension there?
Yep.
How about with this leg? So we'll do both sides to work it differently. So she was having pain and tension, tightness, could be pain, anything through there. So we wrap this strap on it nice and tight, because basically what we're trying to do is make the brain rework how this muscle's firing. So now we have her do this leg 4 to 6 times, up and down, make sure you breathe. And right now that brain's trying to reconfigure. Whether she's sitting, her posture, her bed, stress, I don't know, it could be a lot of different things, but it's throwing that muscle off. And then we'll have her do this leg a couple times.
How long have you been using the straps in your practice?
I've been using them about 1.5 years.
I've never heard of these before.
Really well. It's very simple, takes the pain away. It can be uncomfortable due to its tightness. Then we just pull it off, have her recheck to see if it loosens up and it moves better. And usually right away you'll see it move a lot better.
And Dr. Duncan, what are some other, you have a couple other tools over there.
So this is the activator. This is another tool we can use to adjust where it puts a lot of force through, but you don't get that hardcore thrust in there, and it'll shift the bones. So this is our cold therapy roller ball, 2 hours in the freezer, a good 6 hours of cold therapy, cryotherapy. People use it to roll low backs, necks. We can use it any muscle.
What's the benefit of using cold therapy?
Cold therapy is going to push that blood away, so then your body will reheat it back up and pull the blood back in. Kind of creates a pump.
And Dr. Duncan, what are some red flags that someone may need to see a chiropractor and massage therapist combination?
Definitely, go ahead and come on up.
You can come on up and join us, Kaylin.
Definitely, if you're moving slower,
Yeah.
not moving correctly, you're feeling your hips are off, your knees are off, ankles off, neck usually tension. Another one coming into effect is posture with technology.
Right.
Everybody's leaning forward.
The text neck, I've heard it being called
You're
before.
putting a lot of strain on your nerves and your spinal cord, hence it trickles all the way down.
Definitely. Well, Dr. Duncan and Kaylin, thank you guys so much for being here. We sure appreciate your time. If you would like some more information, you can visit fitqca.com or find Fit Chiropractic on Facebook. We'll also have these details posted on ourquadcities.com. Stay with us. More Living Local is after this.